Well, welcome everybody. My name is Ryan Glatt. I'm a certified personal trainer. I'll introduce myself a little bit more in detail shortly. This is implementing a brain health program for older adults. And thank you, SMARTfit, for hosting this webinar. I'm very excited to be here and share this valuable information with you. My training is as an exercise science major, and I have completed coursework from King's College London in a Masters of Applied Neuroscience program. I'm a brain health coach and a functional aging specialist. I work at a place called the Pacific Brain Health Center, which is a multidisciplinary clinical research institution where we implement many of the techniques that we'll be talking about today. We have neurology, psychiatry, a research department, and we're always looking for interventions, particularly cognitive training and physical activity and exercise interventions that can enhance brain plasticity and slow cognitive decline. So we'll be sharing a lot of that research with you today. Once again, if you have any questions, please do not hesitate to type them into the Q&A. I've been in the health and fitness industry for about 10 years, and neuroscience is my passion, and I'm really excited to share that passion with all of you today and with SMARTfit. So let's quickly talk about the problem. Why should we care about brain health, and why do we care about slowing and preventing cognitive decline? Well, some of these statistics may be familiar or not surprising to you as it's starting to get more coverage. But an estimated 5.8 million Americans aged 65 and older are living with Alzheimer's dementia in 2020. 80% of those are 75 or older, and 2/3 are women. By 2050, the number of people aged 65 and older with Alzheimer's may grow to a projected 13.8 million. Alzheimer's disease is the 6th leading cause of death in the US, the 5th leading cause of death among those 65 and older, and the leading cause of disability and poor health. So unless there's a treatment to slow, stop, or prevent the disease, by 2050, Alzheimer's will cost more than $1 trillion. And that's just financial cost. That's not looking at all the emotional cost and the time spent on managing this disease. It's very difficult. And I think if you know someone that knows someone with Alzheimer's disease, I think all of us would be raising our hands. And we could say dementia as well qualifies for that. So we know this is a cognitive decline epidemic. And it's an epidemic of cognitive impairment. And there's additional statistics that are equally discouraging for individuals with mild cognitive impairment, individuals with subjective cognitive decline, and other comorbid health conditions or just health conditions on their own, such as cancer, MS, Parkinson's disease, also come with their own cognitive impairments. So looking at cognitive health is certainly a really important and significant consideration for public health. This is just a visualization of the worldwide projections of Alzheimer's disease by 2050, just giving you a bit more of a visual of what I showed you earlier. Sometimes visualizing it creates a little bit more urgency, but I think we all understand very well that this is a problem. Now, it's helpful to look at the curve of aging, specifically brain aging. There's many aging curves, but one of the ones that we're talking about is brain aging. And so there's several curves that an individual can be on as they age, and it can kind of change throughout the lifespan based on a variety of inputs. We'll talk about cognitive reserve in a second. But normal aging, where everyone experiences slight cognitive changes during aging. The challenge is discriminating between what is normal and what is abnormal. And so for wellness, and even those that are not feeling much changes, we're interested in optimizing cognitive functioning, these mental functions that we use to interact with the real world on an everyday basis. But we're also interested in improving cognition in those that have impaired cognition. So if we look at the top green line, that is the most ideal place to be, where the curve is going down, but the curve is slower, right? If you kind of extended this trajectory off the screen, you know that it would be going and trending downwards, as all aging curves do, but we would look to have a very slow curve. Compared to the green line below that, which is still very opportune, it's a great place to be relative to the other curves that we'll represent in a second. It's a little bit faster. It's still green, it's still intact, it's still slowed, but it's a little bit faster than the green line above it. Now, when we look at the blue line below that one's a little bit more concerning. Not just because it's faster, but because it can break off into what's called mild cognitive impairment. And we'll describe that stage in a second, and then it could eventually break off into dementia. So we're interested in bringing the blue line to the green line, or stopping the green line to going to a blue line, or even better, stopping the dark blue line where MCI is and bringing that to the light blue line, or just stop it from converting to dementia to that red line. So the preclinical phase of aging is when there's silent changes in the brain. This is usually associated with what's called subjective cognitive decline, which is essentially you've noticed changes, or your clients or patients have noticed changes in their memory, their cognition, their attention, their processing speed, but it's not detectable yet. Or maybe you haven't been to a doctor and the individual may notice changes, but it's not detectable on tests. It might be slightly detectable depending on how sensitive that testing is. And essentially, it's where a stage where the patient knows, but the doctor, the family, the people around them may not. Now, as this might progress towards mild cognitive impairment, people might start to notice. Now, mild cognitive impairment, or MCI, in which there's various different types, is a diagnosable condition. And it's associated with cognitive changes that are of concern to an individual or a family member. And one or more domains of cognition is impaired significantly, but the activities of daily living are preserved. You're able to function, take care of yourself. You might struggle with, financial responsibilities here and there, organizational tasks, certain types of memory tasks, but otherwise you're able to dress yourself, feed yourself, bathe yourself. And then of course we have dementia, in which Alzheimer's is makes up a significant component of. And we have different stages of dementia as well as different types. There's Lewy body dementia, there's Alzheimer's disease, there's vascular dementia, there's mixed dementia. And so we have to be conscious that there's various different types. And within those various different types, there's various different stages. And you can see that the decline is a bit sharper there, or a lot sharper. Mild, moderate, moderately severe, and severe. And so it's important to work with medical professionals to diagnose and sort of quantify where people might be at, and sort of develop this more medical fitness or medical rehab focus, where we can identify where people are on this curve, encourage people to find out where they are on the curve as soon as possible, and then be able to intervene as aggressively as possible wherever we are. Now, you may have heard of this concept called neuroplasticity. So if we were to move from one line of trajectory to the other, it does require some sort of mechanism, and that has to be a mechanism of change. Well, the way the brain changes, the mechanisms underlying those changes, is what's referred to as neuroplasticity. And neuroplasticity is how the brain changes in response to experiences. And this is well available to us late in adulthood, but the effort required is greater. So one of the themes of this webinar is that, yes, we have neuroplastic abilities, but we need to put forth significant cognitive and physical effort to elicit that change. And so I think what most people are missing, especially in active aging, is that we are missing the effort. We do a lot of seated exercises, which isn't bad. We do a lot of brain games, which isn't bad. But we have to ask the question, are these things intense enough relative to the individual to elicit meaningful change? So going from maintenance, meaning we're keeping this person busy, to we are improving this person. That takes a different program than some of the ones I've described. And I know the ones I've described are a little not specific, but we're not going to mention any names or types of programs. But I think we all know of those programs that are meant to just maintain but not improve. The people here, I think, are interested in improvement. Now, in order to improve, we need to consider this concept of cognitive reserve. And cognitive reserve is like a mental gas tank you have in your brain throughout your lifespan. So there's various things that go into this. What kind of gas can fill up this tank? So we have modifiable health factors that include sleep, nutrition, stress management. And one of the ones we're going to be focusing on today primarily is exercise. We also have levels of education, social support, which I think during COVID, we're all figuring out is so important for brain function. You are not alone if you have felt that your cognition has been affected by social isolation and social distancing. I think we all greatly appreciate how important the social contact is, and we'll touch on that. Positive affect, enjoyment is extremely important. Stimulating activities, novel experiences, always learning new things, and cognitive training and cognitive stimulation. What I'm going to posit to you is that these do not need to exist as separate things. What if we could create an intervention or a program that combines exercise, social support, positive mood states, stimulating and novel experiences, and cognitive load simultaneously? If we look at the theoretical combination of those things, that could be a very significant dose of an intervention. It's going to be a bit stronger, a bit sharper than just saying, I'm just going to exercise and not do the rest, or potentially doing these things separately. And there is evidence to support that combining them may be more effective for motor and cognitive outcomes. But let's just quickly talk about brain health in 2020. So there was a survey that was done by Sharp Brains, and 94% of people surveyed agreed that addressing cognition and brain health should be a healthcare priority. 83% would personally take a brief assessment of cognition every year as part of an annual mental health checkup, which either your program should incorporate or someone you partner with should already have in place. 83% of those agree that adults of all ages should take charge of their brain fitness without waiting for their doctors to tell them to. So it's amazing for your doctor to tell you to start living a healthy life, start chasing these things that we know are a part of cognitive reserve that we just discussed. But it's very clear that consumers and people who are decision makers alike agree that people should take charge of their brain health before waiting for someone to tell them to do so. 73% agree that digital technology can significantly complement behavioral and drug-based interventions. So we're not saying either or, we're saying yes and to all these things, but technology can play a significant role. However, in a billion-dollar brain training industry that lacks transfer to real-world tasks, can interventions like SMARTfit, which we'll describe the mechanisms of, help? And I think it's interesting to talk to people who have significantly used these products, and there's great research on brain training, but 9% feel they did not see the results they wanted, 43% remain neutral about the results they wanted, and 48% agree they have seen the results that they wanted. So it's great that it can help for some people, but what we're seeing is there's a lot of people who are kind of neutral, they're not sure if it helped, and because they're really relying on their subjective interpretation of their cognitive improvements. Now, if we go back to that neuroplasticity curve, if we put forth more effort and an intervention that was more effective in combining these modalities of cognitive training, exercise, positive affect, social support, maybe that would be different. And there's early research saying that might be the case. This is an excerpt from 4 exercise trends to try from Harvard Health Letter in May 2020. I don't put this on here so that you have to read it, but this is showing that of 4 trends that include high intensity interval training, battle ropes, and digital fitness, the 4th one was cognitive workouts. So cognitive workouts or cognitive exercise programs or brain health exercise programs, whatever we end up calling them, things that pose dual task challenges for the brain require that you allocate resources both to the activity and the cognitive task. And Dr. Alvaro Pascual-Leon, who is probably one of the foremost, he's an amazing research scientist when it comes to brain stimulation and exercise and brain health. He even gets behind this and says that these types of activities that combine cognitive and physical training engage the frontal lobes, an important part of the brain responsible for executive functions. And those executive functions include decision-making, impulse control, planning, and things of the like. Now, there's other ways we can address different cognitive functions in other areas of the brain theoretically that we'll go through, but how amazing is it to see that this is a trend? We know that digital fitness is a trend. We know connected in-home fitness is a trend, but cognitive fitness. Now, the con that you'll see at the bottom here is that these classes are so new, they are hard to find, but they're starting to pop up. I think everyone here is a first adopter, right? We're here because we're interested in this concept. And I think we need to change this. This is actually a huge problem, is that these classes are hard to find. Not to mention ensuring quality control and making sure we're kind of rolling out these programs in a science-based fashion, but making them available is a huge consideration. And so I think that's what we can all help with here. Now, before we talk about how to do that, I think it's important to understand why. Why are we investing so much time and energy and effort into a program that includes exercise as the primary vehicle for modulating brain health? Well, there's various things that exercise does to the brain. There's 3 levels in which exercise can affect the brain for the simplicity of this webinar. And we're talking about the behavioral level, the micro level, and the macro level. Let's just start with the micro level. The micro level is when you have changes in smaller mechanisms, things like chemicals, neurochemicals, proteins, hormones, growth factors. They're released in the blood that can cross the blood-brain barrier that tell the brain to grow or function better. This includes molecules like BDNF or brain-derived neurotrophic factor that are released as a result of aerobic exercise and physical activity. And there's other ones like vascular endothelial growth factor, VEGF. There's nerve growth factor. There's cathepsin B. We could go through the list of acronyms, but these growth factors are what occurs at the micro level to cross the blood-brain barrier to signal the brain to be healthier. What happens as a response to that is that neurons, these brain cells, start to increase in number and or size and or function and or network connectivity. And I say and or because sometimes we're very focused on the structural changes in the brain when that may not always be the case. Sometimes it's functional neuroplasticity. At the macro level, we have structural changes. we're looking at the whole brain level. Now, over time, this could be things like increasing brain volume, in reducing the reduction or slowing the reduction of brain volume, but it can also be increasing functional activity, getting a brain to function better electrically or from a blood flow perspective. That is something that can precede structural neuroplasticity. We call it functional neuroplasticity, and that can happen very quickly. Behavioral changes, which I think is mostly what we're after, is improving cognition, memory, attention, executive functioning, and mood. Now, exercise could do all this for you, but what we're finding is different types of exercise, different types of prescription, different types of modalities, ones with and without cognitive load, affect the brain differently in different ways. We'll cover some of that. But these are some of the shared mechanisms that most exercise interventions have. Now, when we're talking about improving brain health and cognitive reserve, we're not just talking about exercise. Remember, we already talked about this concept of cognitive reserve, but I want to revisit it because if we're really interested in launching a brain health program for older adults, it's not just exercise. It's not just cognitive motor dual tasking. It's other things as well. So cognitive activity, having healthy diet, either giving advice or providing nutritional services or working with a doctor to plan these healthy diets based on biomarkers. But of course, physical activity increases neurogenesis, the creation of new nerve cells, reduces inflammation, reduces cerebrovascular risk, also increases cardiovascular health, which has direct and indirect benefits on the brain. But if we can incorporate cognitive activity, we can start to utilize those neural networks, increase their resilience, and help, even if the brain does change with age, which it does, we can have these compensatory strategies, teaching the brain to work with what it's got. And the idea would be combining physical activity with cognitive activity, once again, for a more potent intervention. Now, if you have a healthy diet that supports all these synaptic and neurogenic functions, that's even better. But for the sake of this presentation, we're focusing on physical activity and cognitive activity. But all of these things together, we would hope increase brain health, cognitive reserve, and therefore cognitive performance. Something a little bit more complicated, but helpful to show is that when we exercise, especially when we're contracting muscle tissue, we release these things called myokines. And we have a little bit of an acronym soup here. Again, we have irisin, IL-6, IL-15, IGF-1, insulin-like growth factor, and VEGF. Some of these we've mentioned before. And these are myokines, or what's been called exerkines, that get released from muscle tissue and from the peripheral tissue in the body. They go into the bloodstream, cross the blood-brain barrier. And when they cross the blood-brain barrier, they increase these trophic factors. It tells the central nervous system, including the brain, to increase neurogenesis, synaptic plasticity, model dendrites, and that can lead to things like hippocampal plasticity. And the hippocampus is a part of your brain that's responsible for learning and memory, and its reduction in size and function has been attributed to age-related memory loss, as well as memory loss in dementia and mild cognitive impairment. So increasing the resilience, function, and structure of the hippocampus is incredibly important. Therefore, if we change the function and or structure of this region, we are likely to increase things like learning and memory, as well as other cognitive functions. Now, how long does this take? If I start to implement these interventions, how long does this take? Well, the synapses, the connections between the neurons, they can be modified in milliseconds. This is what's observed in the process of skill learning, introducing novel tasks. The branching of synapses and dendrites can take several hours. The formation of new brain cells can take several days. And then the network changes of these brain cells can take several weeks and months. Now, we're all playing the long-term game, and so higher level brain changes in function and structure do take several months and years. Now, these timelines are not definitive. Brain cells can be produced sooner than when I presented. You can have changes in hippocampal volume as little as 4 to 6 weeks, but the significance and the staying power of these adaptations is more of what we're looking for. And when we're looking at gray matter and neurons, there's a lot of evidence demonstrating that exercise can facilitate these changes. In fact, this picture on the lower right-hand side came from an article. It's a little bit debated, but it's an interesting one, showing that over 80% of the brain's gray matter is modifiable by physical activity alone. Now, some of this is debated simply because of the structure of these studies that was reviewed. It's across populations, but look how sensitive the brain is potentially to physical activity. And if we incorporated cognitive load, if we incorporated cognitive activity, maybe that's greater. Or when we, for example, create new neurons, maybe we integrate and allow those neurons to survive better. And so we'll cover some of those functions. Now, why do we care about cognition and physical activity? Well, it's because these aging pathways are shared. So when we have cognitive impairment, it can be bidirectionally related to changes in gait, which is walking, or motor impairments. And we'll talk at the very end about another webinar that Dr. Mike Suter will be delivering about dual task costs and how dual task costs can be predictive and valuable in the treatment of cognitive impairments and gait and motor impairments. But we can see that even things like slow gait velocity can lead to falls and fractures, and that can be related to cognitive impairment. We see some of these shared mechanisms among vascular risk factors and neurodegeneration, and we find that it's not just for MCI and dementia, it also includes other neurodegenerative diseases such as Parkinson's disease. So this is a complex relationship we're working with. It's likely that many of you either have cognitive training programs that are sedentary, that focus on cognitive engagement and stimulation, and or physical activity programs, but they exist on their own. And it would be beneficial to bring them together because we're seeing these shared mechanisms in the aging process that if we can target, we can likely delay cognitive and physical decline greater, or rather at a greater rate. So are the general recommendations for exercise enough for brain health? And I think it's helpful to just state them. You've probably heard this, that for substantial health benefits, adults should seek to do 150 to 300 minutes of aerobic exercise a week at a moderate to vigorous intensity. Now, when we say aerobic exercise, that's just getting your heart rate up at above a resting level. And there's, of course, different zones and percentage of max intensities that we won't get into now. But there's additional benefits for neuromotor training and strength training, as well as more minutes of activity. Now, it depends who we're talking about. Are we talking about with someone with cognitive impairment or someone without? And it does matter. But let's talk about this neuromotor training category. We hear about the aerobic exercise, we hear about the resistance training, but the neuromotor training category is really one that people don't talk about. And it includes hand-eye coordination, foot-eye coordination, proprioceptive, power training, more cognitively demanding physical activities, things like dual task, open skills, which we'll define. And so I think what people are missing from their exercise and physical activity programs is neuromotor training. But how great would it be to have aerobic exercise, strength, and neuromotor all in one, all of them with some sort of cognitive demands? And so that's what I'm going to posit to you as the potentially most valuable program for brain health. Now, should we just do one of these? No. Research is showing that if we were to slow dementia risk or progression of cognitive decline, we'd want multi-domain exercise programs. In having a multi-domain exercise program, for example, combining aerobic with resistance or neuromotor with strength, is going to slow the progression of cognitive decline more than a single modality program. In addition, a recent systematic review found that it took about 52 hours of exercise to lead to improvements in executive functioning and processing speed in older adults, regardless of modality. So it's a little contradictory. On one hand, I'm talking about the modality matters. On the other hand, this research is showing it may not matter, just get to 52 hours. If we're also talking about cognitively enhanced physical activity interventions, such as extra gaming interventions, where you're playing a game with your body, a systematic review has shown that no earlier than 12 weeks, you need at least 12 weeks of training to see significant improvements in executive functioning and processing speed as well. So keep this exercise prescription in mind as we start to seek out building a brain health program, because our brain health program should at least be 12 weeks in length, have at least 52 hours of training, and include multiple modalities. Now, just to differentiate between two different types of training, we have aerobics and strength training. That sort of constitutes this physical training, if you will. And those are associated with more metabolic demands, increasing muscle tension, increasing heart rate. But on the right-hand side, we have balance and coordination and flexibility, which constitutes motor training. This is synonymous to that neuromotor category we just described, but when you combine them together, there are specific skills. So we would agree that tennis has a metabolic demand and it has a motor demand. But as we found with COVID and with social distancing and with changes in air quality, it's not always reliable to be able to engage in sports, dance, and martial arts, these neuromotor categories. So we need technology and programs to superimpose, to artificially create or supplement with the cognitive and physical load that may come from these activities, especially when we're looking at senior living facilities or communities where we are actually creating an environment. While we may have these activities accessible, we need to look at the dosage of those activities as well. And sometimes being able to supplement that cognitive load through physical activity, it's hitting two birds with one stone and may be more effective. Another thing that motor training and physical training may have in common when they're combined is dual tasks. And it's not just counting backwards by while walking, it's a little bit more complicated than that. That's referring to the timed up and go dual task, which is a test of dual task ability. In our second webinar, we'll be talking about dual tasks a lot more. But it's showing this is showing us that combining these, as well as having a variety of them, is preferred for enhancing cognition in older age through exercise. This is a bit of a busy graphic that I've created to try to summarize some of the research. The main takeaway of this graphic here is that different types of exercises and activities, as well as the stimuli within them, will likely stimulate different regions of the brain. Now, there is a weakness to having this regional approach to changes in the brain. It's a little bit archaic. We know that the brain doesn't function in isolated ways. It's actually interconnected. It's very complicated. But this is based on research showing changes in these brain regions as a result of some of these activities. So I created this graphic to try to summarize these. It's not that we need to memorize this per se, but it's to give us a deep appreciation for the science that is out there showing that yes, a variety of activities will likely ensure a whole brain exercise and physical activity program. So let's just look at the frontal lobe, which is in the front of your brain here. Cognitively demanding activities, open skill activities, which we'll define, resistance training, mind-body exercise, that's shown to increase gray matter, improved executive functions, more efficient brain activity. When we look at the temporal lobes, which is right underneath the ears there, especially the medial temporal lobes where the hippocampus lies, we're seeing that closed skill activities, cardiovascular exercise, and generalized physical activity can lead to increased neurogenesis, increased hippocampal volumes, and improved learning and memory. We've touched on that a bit earlier. Then we have the parietal lobe, sensory-rich activities, proprioception activities, object-based, visuospatial, where am I in space? These types of activities increase white matter volume in this area, sensory network activity, and improved task switching abilities. When we look at the occipital lobe, there's been some interesting studies showing that masters athletes compared to sedentary older adults as controls had greater occipital lobe volume, likely because of these visuospatial and visual attention demands that are part of these sports. We also recognize that within motor control and stimulation, there's some visual input that plays a role there. Then, of course, we have the cerebellum, and not pictured here because it's deeper in the brain, the basal ganglia. Coordinative exercise, skill and motor activity, as well as open skills activity seem to target the cerebellum and basal ganglia. In fact, there's some early research showing that aerobic exercise may not target that region as much as it targets the hippocampus, and motor activities do target this region. It doesn't mean they're exclusive to each other. There is research showing that aerobic exercise does increase volume of the basal ganglia, and that resistance training also can increase volume and function of the hippocampus. So there is some, I want you to be aware of the weaknesses of this approach, but it is helpful to look at it in this way, and I hope it gives you an appreciation for why a lot of variability in different types of activities are important for a whole brain exercise program. So now let's talk about adding cognitive load to exercise. And before I do, I just want to check to see if there's any questions. Okay, I don't see any questions yet. No worries. Either I'm putting you to sleep or we're doing a good job. So let's keep going. So let's talk about adding cognitive load to exercise. So what's wrong with just basic exercise for brain health? And when I say basic, I'm referring to the, on the exercise bike, watching the news, leisurely going along, walking programs. If that's all we did, that could be potentially problematic if brain health and cognitive vitality was our goal. So we want to go beyond moving to moving with thought. And this comes from Dr. Adele Diamond, who mostly has done her research in children, but is one of the foremost experts on sort of, identifying and criticizing and studying studies done on interventions that could enhance cognition, such as exercise. And I really like what she's putting forward here, because most activities require little thought. We're talking about cardio machines, exercise machines, brisk walking. These are helpful. These are great for brain health. But if we were to do better, are they enough? And perhaps not. Cognitively engaging exercise appears to have a stronger effect in some cases than non-cognitively engaging exercise. Does that mean that non-cognitively engaging exercise, what we've been doing all along, is bad for the brain? No. But it seems that if we were to enhance cognitive load, demand our cognitive functions, that might be a little bit better for cognitive functions themselves. And it makes sense. So we look at exercises that train and challenge diverse executive functions. That includes dance, sports, martial arts, performance arts. What can we learn from these? Because especially in active aging, it's not always practical to just say, do these all the time. We may not have the facilities, the instruction, the ability, the confidence to do all of these things. We may not have the specialized instruction. So what can we learn from these? We can understand that they have certain elements of skill and cognitive load, and how can we recreate some of these in a brain health program? And importantly, we're not just talking about cognition and brain health and the quantification, but the qualitative aspect of it, the exercise that brings joy, pride, confidence, a balance of challenge and skill, but not frustration or demotivation. And so staying in that flow state, that balance of challenge and skill is also important. In other words, having fun. Having fun is incredibly important when we're looking at tasks that incorporate some sort of cognitive load. Especially when we're working with active aging, we need to be conscientious of the fact that some people may be very self-conscious about their cognitive abilities, especially if they have an impairment and they have insight or they just started to notice changes. So it's important to approach that right, but it's better if we can have pride, joy, and confidence. Nobody wants to go to an exercise class where it feels like you're doing SAT test taking. So that's important to keep in mind. Now, we've talked about a couple different types of skills. We've talked about open skills versus closed skills. Closed skills really have to do with a stable and predictable environment. Movements have a clear beginning and end, and the performer knows what to do and when. These are valuable. These are the traditional resistance, traditional aerobic training programs, and traditional balance training programs that have been studied in physical therapy and exercise science for many years. These are showing benefits, but what research is also starting to show is that open skills that consist of environments that are constantly changing, movements have to be adapted, and they're predominantly externally paced by another person or technology, do have different effects on the brain than closed skills. There's a systematic review comparing open skills to closed skills showing that open skills may improve cognition in a unique way and for those specific cognitive domains better than closed skills. It does not mean that open skills are better than closed skills all the time, but most of us, especially in more scalable, larger exercise programs, usually rely on closed skills because they can be self-directed, it doesn't take a lot of sophistication, and the technology hasn't really been available or that present in our space to be able to facilitate more open skills in a gym or rehabilitation environment. And so the individual here is playing tennis, but how reasonable is it for all of our active aging clients and patients to play tennis all the time to get these open skill formats? In addition, there's only specific adaptations relevant to that sport. What about the types of cognitive demands that would come from other modalities like dance or martial arts that they may not participate in? How do we get that cognitive load? In addition, we talked about joy and confidence and the flow state. And what's definitely related to that is the gamification concept, where you should have a goal, you should have learning, there should be a skill involved, you should have achievement, you should have challenge, you should have reward, you should compete, and you should have engagement. And when you have all these things, you have, I think gamification is uniquely positioned to do well with cognitive load, because we look at video games, for instance, that have a cognitive load, but they also have gamification concepts built into them. And this is something that the rehab and fitness industry and the active aging industry is trying so hard to channel, because we know how valuable it is for engagement. But these types of things, when we have skill and learning and challenge and reward, it sounds like we're setting ourselves up for a neurochemical smoothie that is quite beneficial as a result of this intervention, especially if we have downstream increased physiology of blood flow and these growth factors that come from exercise. So exergaming is something that really started all this. We talk about Dance Dance Revolution, the Nintendo Wii, but going to clinical, serious exergaming is what I think people are interested in here. Now, why might we do that? Why might we combine cognitive load with physical movement? Is this something that is evolutionarily sound? And as presented by this adaptive capacity model by Dr. David Reichland and his team here, who was recently featured in Scientific American, and in their article, they talked about combined cognitive physical training interventions. They've done cognitive physical training interventions and shown enhanced executive functions when compared to a normal exercise and cognitive training program. So they are doing some of this research, but they put forward this really interesting evolutionary model combining cognitive and physical load. And so as we evolved, these cave people, if we can call them that, needed to use their executive functioning demands, their problem solving, their cognitive flexibility, their decision making, their planning, their sensory and attention systems, paying attention to the real world, using their eyes, using their ears, their vestibular system, their writing reflexes, their proprioception. And they need to use their spatial memory and navigation systems to navigate an environment and remember where things were. They need to use motor learning and control to manipulate, learn, and use tools. And they need to have a variety of speeds, from slower speeds to faster speeds. So if we can incorporate these elements into our program, using the sensory systems, using cognition, both executive functions and spatial navigation, using novel tools, and going from slower speeds to faster speeds, this would likely target these functions. And this just shows that maybe this is how we evolved. There's a lot of evolutionary theories out there. Oh, maybe it was the barefoot running. Maybe it was the fact we ate protein. But I like this because this is showing the process. And maybe because we demanded our cognitive functions while we were exercising, while we consumed protein, for instance, that would facilitate the growth of the brain from a top-down, bottom-up, and external-in perspective. So I really like this model. It helps me understand it better. There's some other theoretical models. This is from Kerlick and Shores et al. 2013, talking about how, from a neurogenesis perspective, combined cognitive and physical activity might make a difference. Now, you don't really feel your neurons on a regular basis. It's hard to get an exact neuronal count on people. In fact, we don't do that typically. We typically just do that in animal models. But what's interesting here is the theoretical representation of how this might work at a neuronal basis. So with no training, if we don't do any cognitive or any physical training, we're likely to lose neurons because of aging. If we do physical exercise, we gain neurons, but we may not keep them all. If we do mental exercise, we're likely to engage and stimulate those neurons and therefore keep them, sort of the use it or lose it hypothesis. But when we combine mental and physical training, it's likely that we will create the neurons from exercise, keep them, and integrate them as a result of simultaneous mental activity. And you may ask, well, what about doing a brain game before or after exercise? We'll cover that. There's actually research showing that simultaneous engagement seems to be superior. Now, I'm going to bring up this fancy phrase, cognitive motor dual tasking, which will be better defined on the second portion of this webinar. But just to summarize some of that research, and we use cognitive motor dual tasking and cognitive physical training and combined brain-body interventions sort of synonymously. It depends who we're talking to here. But cognitive motor dual tasking may be a valid assessment in various neurological populations. In many ways, it has shown to be so. CMDT has also been shown to enhance both cognitive and motor outcomes in neuro-rehabilitation, healthy aging, and even pediatric populations. And there's equivalence to exercise or cognitive training alone and or potentially more of a response. Now, several studies demonstrate that CDMT may provide better cognitive outcomes than cognitive or physical separately. And this is a bit blurry, but to show you this picture from Harold et al. 2018. This article is called Thinking While Moving or Moving While Thinking, Concepts of Motor Cognitive Training for Cognitive Performance Enhancement. On the right side, we're showing the simultaneous motor cognitive training and how it relates to the left side, which is the sequential motor cognitive training. And essentially, we're seeing that sequential motor cognitive training, i.e. I ride a bike and then do a sedentary brain game, it's facilitated. We get neuroplastic change, but when we have the simultaneous, there seems to be this enhanced neuroplastic response. And there have been systematic reviews comparing the two, where simultaneous seems to be superior. Sequential is still beneficial, but I think we're interested in what is a superior mechanism here. All right, now let's talk about building a brain health program. I just wanted to give some higher level guidelines on how we might start to do this. We understand and appreciate the science. We understand the components that we should have. We should have a multimodal training program. It should be cognitively demanding. It should be at least 12 weeks in length. We understand the role of technology. It should be gamified. This is hard to do on your own, but luckily we have solutions to help us do this. So in order to create a brain health program, we need to identify the population of interest. Are we working, and most of you likely have that in mind. So for some of you, this may be, well, this is my rehab community, my senior living community. I already know who that is, but it's important to identify them further. What is their level of physical function? What is their level of cognitive function? Do they have comorbidities? Do they have neurological or neurodegenerative conditions? Is it healthy aging? Are you working in a senior living community, but do you want to start a program to attract people in the community? Is it yes to all of it? If so, you need to be specific about the population of interest, because it does make a difference in the programming, in the equipment that you get, the people that you train, the people that you hire. You also want to identify specialized equipment. What equipment do we need to deliver this kind of intervention, this brain health program to this population? And then we need to develop targeted programming. This is dependent on what's available out there in terms of licensing and technology and expertise. But I've given you some hints here. The programming should have some parameters of at least 52 hours, at least 12 weeks, have a variety of cognitive load, be enjoyable. And of course, that's just the higher level. And we have things like aerobic and strength and resistance and neuromotor, right? We want to have those components. The specific techniques and the specific acute variables, that's not appropriate to cover, or rather we don't have time to cover that in this presentation. But yes, that does need to be identified. Then we need to educate and certify the staff. Sometimes that's an army of one, and sometimes that's starting as an army of one and then bringing on more people. Sometimes you already have a whole staff and they're excited perhaps to get educated and certified to understand the benefits of this type of programming. And then of course we need to deliver the programming. Now this does not have to happen in a sequential order, but oftentimes what I see is that when people start delivering programming before having the staffing, they have trouble with scalability and quality control and things of that regard. And of course, when you deliver the programming, you need to iterate and improve that programming. So once again, this is not a rule. This is just what I've seen having consulted with various communities and rehabilitation facilities and programs, that this is the best way to structure this type of brain health program. Of course, when we're identifying who we are working with, the Functional Aging Institute, who is a partner of mine, and SMARTfit, they've put forward this model that we can really understand what is the level that we're working at. So 1 being the elite masters athlete, 2 being fully fit, 3 being semi-fit, 4 being higher independence. This is about staying young, enjoying retirement, enjoying the life that you're living now. Now, 5 and 6, lower independence and pre-frailty, usually is associated with recovery after a neurological or orthopedic setback. Now, if they are frail or dependent, we're talking about skilled nursing, certain aspects of senior living, and we look at 7 and 8, it's about getting the most out of the aging process. Now, that's not exclusive to just 7 and 8. I think all across the board, we want to get the most out of everything. A setback can happen at the elite athlete level. Oftentimes it can. And so these types of goals are not specific or unique to these different phases, but I think it's important to identify the phases and identify who we may be working with here. Now, to summarize a little bit, we do want a multimodal exercise program for brain health. At the minimum, it should have these 4 components. We should have aerobic exercise, resistance training, cognitive training, and neuromotor training. Some of these can overlap. Is it possible that my resistance training program can get my heart rate up? Yes. Is it possible that a resistance training program can be cognitively demanding? Yes. Is it possible that my neuromotor interventions, such as my balance interventions, can have aspects of cognitive load? Yes. And so on and so forth. So you can combine these in a variety of ways. They don't have to exist as separate islands, but you do want to fulfill these components. However, the downside of hitting several birds with one stone is that you might miss out on the dose response opportunity by focusing on individual modalities, but there's not enough research on that just yet. Another model from the Functional Aging Institute is this sort of this honeycomb model of physical function. For older adults and active aging, what do we need to consider? Well, we need to consider balance, cardiorespiratory fitness, musculoskeletal fitness, neuromuscular fitness, mobility, cognitive, and even emotional valence. We want to look at having a program that addresses all of these. So before, this is a bit more simple way of looking at it, but here we have a lot of subdomains that we could populate with our programming that we should consider. I do have a question. I will get to that in a second. And so when we're looking at these different types of domains, you should question, okay, well, I do have a cardio program, but it's primarily aerobic and not anaerobic, for instance, or vice versa. Or I do have a strengthening program, but we don't train power in our older adults. Or I have a mobility program, but we don't train agility, which may also be more cognitively demanding depending on how it is rolled out. And you could say the same thing. So you might be looking at this and saying, well, what am I not doing in my program? Or what are other programs not doing that I could start doing that makes us a different differentiator? So the good thing is there's a lot of options. The bad thing is there's a lot of work to be done, but it's purposeful, meaningful, and I believe fun work. And the programming that meets all of these variables can be developed. Now, it would be great if we had a technology, a turnkey solution, if you will, to provide strength, balance, neuromotor, cognitive, aerobic, all in one. And this is what SMARTfit, I believe, can do. And this is what we found at our facility, is that we can facilitate all of these modalities through a single technology. And of course, this SMARTfit has various different types of products that allow you to facilitate it. But at its core, multimodal training that incorporates cognitive load is available. And there's turnkey programming in the system that SMARTfit, myself, and other experts have built to actually deliver what I've been showing here and here in a turnkey program via an application that controls these different systems. And so what we're seeing is a lot of different examples of individuals at different stages of function, physical and cognitive, those engaging in different types of modalities: resistance, motor, neuromotor, balance, strength, agility, and we're seeing people have fun. And so all of these things are incredibly important within a program. It's not just about responding to a light and calling it reaction time and doing that with your feet, as you see with many other products. It's doing it with a variety of different limbs and a variety of different contexts and a variety of different modalities and with different tools, with a lot of variability of cognitive load. So it's not just one reaction time game. It's a variety of different games and activities that can target a plethora of cognitive functions, just as these brain games do, but bringing that to the concept of combined cognitive physical training or cognitive motor dual tasking. And the reason we would do this is because all these systems of aging are interconnected. So we want to train posture while we train neuromuscular functioning, while we train motor control, while we train loaded movement, while we train executive functions, while we train reaction time, and while we train the visual and vestibular system. Now you may be thinking, well, I have to come up with an exercise for every single one of these. Well, if we look at what's going on with SMARTfit here, a lot of those things are fulfilled just through the process of interacting with the system under the guise of intelligent programming. And so when we're looking at the interconnected systems of aging, from vestibular to neuromuscular, to executive functioning, to reaction time, to visual function and acuity, it's important to train all these things in addition to the 4 domains I stated. And the way you can do that is through delivering an integrative turnkey cognitive motor training intervention. Now, the reason I like SMARTfit is because it has 4 different ways in which it can integrate into a program. There's the concept of repair, which is really prevalent in orthopedic and acute neuro, such as stroke rehab or traumatic brain injury. You can prevent the decline of cognitive aging, or at least we hope, as dictated by these aging curves that we've discussed. Mild cognitive impairment, certain types of dementia, fall prevention, for instance. We can slow the onset of neurodegenerative diseases, Parkinson's, MCI, dementia. And there is research showing that exergaming interventions, dual tasking interventions, cognitively enhanced interventions are effective in some ways in slowing or improving cognitive domains in these populations. Yes, even those with neurodegenerative conditions. The degree of significance and the variability there depends on a whole lot of other things, but if you're looking for those studies, you'll have an opportunity to contact me for those. And then of course, performance, where we're optimizing motor and cognitive outcomes. And this can be in the aging population. Sometimes we start with repair and then we graduate to performance. Or we start with repair, we just found out we got diagnosed with Parkinson's. It's early, we're really doing a good job at managing it, but we want to optimize certain cognitive and motor domains there. And so there's a variety of ways in which you're able to do this. SMARTfit has a wide variety of products for you to create a very engaging setup to have group programming, one-on-one training, rehabilitation programs, self-directed training programs, sport programs on these systems. And certainly depending on your budget, your facility, your space, what kind of programming you're going to have dictates which one of these products that you will get. But our facility is about 4,000 square feet. We actually have all of these products. We have products that are these larger walls, what we call the Pro Trainer system, that allows for group training and larger, more open skill training using sports and different types of modalities there. The Mini is probably the one on the lower left-hand side is probably one of the most flexible systems we have. We can move it to and fro. We can change the height of the panel there. The Single also is great. It's nice and tall, and you can see that the Pro Trainer is made up of several single units. The pods we also use and connect with the Minis to create a 360 training environment. We also, they're portable, and we can take them to events, and we can take them to our clients and patients' homes. And of course, on the lower right-hand side, we have a new product that's coming out. That's a new version of the Mini that's even more lightweight and portable to go from room to room for if you wanted to do that. One of the best formats, I think, for group training once this COVID stuff has sort of passed and we can have rapid testing and it's safe to go back to group training, I think this is extremely valuable. And this is sort of the environment that we have. It doesn't exactly look like this at the Pacific Brain Health Center, but we have a Pro Trainer, we have a Mini, we have some pods, and of course we have a plethora of other cognitive and physical training equipment. But having a nice open space where we can implement speed, agility, quickness equipment, loaded implements, balls, things of that regard in this open space is really what we find to be ideal. Sort of the crowded, not so functional gym environment, once again, going from closed skill to open skill, we tend to move away from that. But this is sort of the format that we have. And we're finding that as people start to integrate these programs, this is ideal for group training. But this is also, I use this space for one-on-one training, which we've been doing since group training has been a little unavailable to us for the moment. And so this works well with any type of program, rehab, whether it's multiple sessions or one session at a time, one-on-one training if it's an out-of-pocket service, group training, if you will. And so this format works extremely well. In addition, we touched on training, and I created a course called the Brain Health Trainer course, which is a 10-hour online course that's approved by a variety of health and fitness organizations.